Linda!
I'm right here, Harold.
Oh, well, I thought we paid this bill, Linda.
We did. That's the receipt. Who's at the door, Harold?
Oh, hell if I know, Linda.
Well, who is it, Harold?
I don't know, Linda.
Who's at the door?
It's just some hood rat or something. I don't.
Harold! I'm pregnant and it's your baby!
I'm gonna get to the bottom of this.
Oh, Linda, wait, Linda.
Hey, Harold, I've been trying to get a hold of you. Where you been?
Who are you?
This is Angel, baby. Who are you?
I'm his wife.
I don't care who you are.
Harold, I cannot believe this. Harold?
I don't know what happened. He was just gripping his chest and he's been like this ever since he fell down. I don't have a pulse. He's not breathing. It's not working. Charge paddles to 150, clear. Charge paddles to 200, clear.
Oh, shit.
Harold?
Where am I?
You're in the emergency room right now.
Why didn't you just let me die?
How are you feeling, Harold?
Well, my chest hurts and I can't breathe and
Okay, we're going to take your vitals and run some tests, okay?
Alright, so what's the issue here?
Okay, we have a 76-year-old man named Harold who's complaining of chest pain, and he had pain radiating down his left arm, and moments later he collapsed.
So what happened after that?
Okay, the paramedics found him unresponsive, not breathing, without a pulse, and they followed with CPR and electroconvulsion shock. In the emergency room, he was complaining of chest pain and shortness of breath.
We see that he has 85/50 mmHg blood pressure. However, blood pressure normally should range from 90/60 and 120/80. So Harold has hypertension.
The blood pressure in the arteries is lower than normal. There could be an underlying heart disease. However, chronic low blood pressure is almost never serious, but if one's heart rate is elevated, then yes, it's very serious.
Okay, well that explains his heart rate of 175 beats per minute. Since his heart rate is so high, the heart is trying to compensate for the low blood pressure. We should prescribe fludrocortisone, which promotes sodium retention. This will help to regulate his blood pressure and heart rate.
Okay, so that's good, but we should also have Harold make some changes to his lifestyle as well. He should increase his salt uptake because increasing the salt uptake can help increase his blood pressure. He also should drink more water. The fluids can increase the blood volume. It can also help increase the blood pressure as well. As for extreme cases, wearing the compression socks can help because they will limit the blood flow to his legs and keep his blood in his upper body.
Next, there is obviously a very high respiratory rate, and that could be a result of acidosis. We know he was unconscious and not breathing when the paramedics arrived to the scene, and the absence of breath increased acidity levels because its inability to excrete.
Sounds about right. An increase in the acidity of the blood results in an increased retention of carbon dioxide due to his hypoventilation earlier, and hence an increased rate of breathing. It can also be a predictor of cardiac arrest in people hospitalized with heart conditions. His elevated respiratory rate explains the dyspnea as well.
His temperature is slightly above normal, which normally adults it's about lower than 98.6, but Harold's is at 99.2. I don't think he's going through this yet, but I think that he will eventually go through acute pericarditis. This can occur after a heart attack, and the body's immune system goes into overdrive to try to clean up the damaged tissue. The immune system makes healthy heart tissue as damaged and attacks it, resulting in more damage and inflammation. If left untreated, it can be life-threatening.
Symptoms of acute pericarditis is fever, tachycardia, and difficulty breathing. Treatments could be with prednisone, which would reduce the inflammation and slow down the immune system from going into overdrive, and it would not affect his kidneys or liver if they are to have any issues at all.
Ectomy could be needed if he is not responding well to the medication.
So what are the results of the ECG?
These abnormal Q waves indicate that there is an old or ongoing myocardial infarction. These are a result of the absence of electrical conduction cells that were damaged when oxygen-rich blood could no longer reach his heart, leaving almost an electrical hole. These problems caused a block at the left bundle branch, causing elevated ST segments.
All right, he might need a pacemaker. Let's look at his blood testing now.
There are elevated levels of creatine phosphokinase, which are of cardiac muscle origin, and it is a protein that helps electrochemical changes in the body, such as in the heart, brain, and skeletal muscles. When the muscle tissue is damaged, it leaks into the blood, so we should take some action about the tissue damage that's been done in the heart before acute pericarditis becomes chronic.
Harold's pH is at 7.22. However, normal pH levels are supposed to be within 7.35 to 7.45. So his levels is below the normal, making it more acidic.
Just as we assumed, it could be causing his elevated respiratory rate.
His PCO2 is above the norm of 35 to 45. He is at 30 mmHg. Here we see the bicarbonate HCO3 level is at a very low of 12 milliequivalents per liter when it should be within 22 to 30.
The body was unable to retain enough of the bicarbonate, which causes the blood pH to drop below 7.35. The blood pH, PaCO2, and HCO3 do reveal that he in fact does have partly compensated acidosis.
And we already know that the cause of this would be lactic acidosis, because lactic acidosis is when the cells in the body make lactic acid. When the body does not have a lot of oxygen to use and causes the acid to build up, and this situation usually happens after cardiac arrest.
It says right here that Harold's PO2 is at 70 mmHg when it should be between 72 and 104, so it is below normal. So his oxygen levels show that he's going through hypoxia because lowered PO2 correlates with alveolar respiration.
What's going on with his hemoglobin O2 saturation level?
Oxygen saturation refers to the level of oxygen carried by red blood cells through arteries and delivered to internal organs. As red blood cells travel to the lungs, they are saturated with oxygen. A low saturation level would indicate a respiratory illness or other medical conditions. Harold's O2 saturation level is at 88%, which normally should be about 96 to 99%. When oxygen saturation levels dip below the normal range, treatment usually involves oxygen therapy. A high concentration of oxygen is delivered by a ventilator through a mask or a nasal cannula.
Okay, well, based on the bicarbonate, the acidosis is causing the blood not letting the oxygen go, and the waste is not being removed.
You guys got a PCI and an MRI, right?
Yes.
All right, let's call up Dr. Mia and see what she has to say. Okay, Mia, what's your diagnosis?
According to the signs, symptoms, and blood test results, the disease is a myocardial infarction, which is a heart attack. Chest pain is the most common symptom. The blood test revealed that most all levels were low and his body was suffering from acidosis starting from lack of oxygen, which affected the rest of his body. The heart is trying to keep up, and pumping blood through clogged arteries takes more of an effort.
Okay, then why is his skin cold and clammy?
The heart is trying to keep up, and pumping blood through clogged arteries takes more of an effort. The body sweats more to try and keep the body's temperature down and prevent more exertion.
Thank you for your insight, Dr. Mia. Goodbye. Discussing more the acid-base imbalance, the patient's compensating because the patient's hyperventilation is driving the arterial PCO2 downward and causing more production of carbonic acid. This carbonic acid is then converted to CO2 and H2O, the former being excreted through the lungs. The net effect of the process is remove some of the excess H plus ions from the bloodstream, thus helping to correct the metabolic acidosis.
These acid-based disturbances can be caused by DKA, alcohol, or diabetes. If Harold's body did not have to compensate for the acid-based disturbance,
The ideal or normal pH would be 7.45 using
the Henderson equation. However, since Harold's body did compensate, his pH was 7.22, which makes his blood acidic. If there was no compensation taking place during the acid-basic disturbance, we can safely assume his blood pH would be below 7.22. Why did you place the PCI before the MRI?
A PCI is when they use a stent to open up a narrow artery by inflating a small net-like balloon, and an MRI is performed following the PCI to check if there's any blood clots formed. Okay, well, we got all the information we need. Harold, you had a heart attack, but to be more specific, you had a ST elevation myocardial infarction. But don't worry, we're going to take good care of you.